Have you ever seen someone wave around a vaccine insert like it's a courtroom gotcha moment? Look, it says encephalitis, it says seizures. What are you hiding from us? As if it's proof that doctors and scientists have been hiding something all along. Here's the thing. I have read the inserts. I'm Dr. Mona Amin, a board-certified pediatrician and mom, and today we're going to break down what vaccine inserts actually are, walk you through the MMR vaccine insert, and compare it with something far more helpful for parents, the Vaccine Information Statement, or VIS sheet. So if you've ever been confused or overwhelmed by all the noise around vaccine risks, this episode is for you. Be sure to hit that subscribe button so you don't miss out on videos that help you feel confident about your child's health, development, and behavior. Let's get into it. A vaccine insert, also called a package insert, is a legal document created by the vaccine manufacturer and required by the FDA. It's folded up inside the vaccine box and publicly available online. Yep, even on the FDA website. Here is one for MMR. Let's open it up. They are literally inserted in the boxes of vaccines we use and are available publicly online as well if you cannot get your hands on one of these. It includes ingredients, dosage instructions, information for clinicians giving the vaccine, and a list of side effects. Think of it like the giant paper that comes with your antibiotics, birth control, or even Tylenol. Most of us toss it without reading a word. We don't read the insert for Tylenol and yell, "It says liver failure." But when it's a vaccine, suddenly that same kind of legal document is waved around like a smoking gun. When Tylenol is used correctly, the risk of liver failure is low to none, and just like vaccines, the risk of serious side effects is even more rare. Yes, you'll see things like encephalitis or seizures listed in some vaccine inserts, but just like Tylenol's insert says may cause liver failure, it doesn't mean it's common, or maybe even caused by the vaccine. Why? Because package inserts list any reported event, no matter how rare or unproven. Even if something happened once in a million doses, it still gets listed, whether or not the vaccine was the actual cause. That's why you'll see phrases like may cause. It's legal language, not a risk calculator. And those side effects, they include anything that happened during clinical trials and events reported after the vaccine went to market. But again, these are reported, not always confirmed. The insert doesn't tell you how likely something is or whether it was directly caused by the vaccine. It's a legal document, not a medical guide. And this can't be stressed enough. You absolutely have the right to read the insert. It's publicly available online. But it's important to remember what it is and isn't, because some people claim the vaccine insert holds hidden truths Big Pharma doesn't want you to see. But in reality, that information is required by law, isn't secret, and often lists potential associations, not proven causes. Ironically, the loudest calls to read the insert often come from those who don't actually give vaccines and don't see the real risks of disease versus vaccination, leading to a skewed interpretation. So what does real informed consent actually look like? It's not scrolling through a PDF at 2 a.m. with the highlighter in hand. It's not deciphering legal disclaimers or trying to guess which risks are common, rare, or even related. And it's definitely not following accounts that shout, "Read the insert," without any background in clinical medicine or an understanding of the actual risks of the diseases we're trying to prevent. True informed consent is about context. It's a conversation with someone who understands the evidence, the real-world risks of infection, and how the benefits of vaccination compare to potential side effects. Think of it like this. If you needed your tonsils removed, you wouldn't base your decision on a legal document from the surgical tool manufacturer. You'd talk to an ear, nose, throat surgeon, a human being, someone who understands when the procedure is appropriate, what the options are, and what the risks and benefits are for you. That is informed consent. When it comes to vaccines, it's the same. You don't need a dense legal document meant for regulatory compliance. You need medical context as well. That's where the Vaccine Information Statement, or VIS sheet, comes in and speaking to your clinician. And stay tuned because we will be discussing VIS sheets later in this video. And as a reminder, if you're learning something already, hit that subscribe button so you don't miss future videos, including more education surrounding vaccines. So let's break down the MMR vaccine package insert, the one that often gets shared out of context online. This document is structured like many medical or pharmaceutical legal documents, but instead of letting fear take the lead, let's walk through what each section actually means and how to approach it. Table of contents. Right up top, there's a table of contents that outlines each section numbered 1 to 17. Each section has a distinct purpose. Most of it's technical and written for clinicians, researchers, and regulatory agencies, not the general public. But let's look at the most commonly misunderstood sections. How to approach the insert. Think of this document as a legal record, not a personalized guide for you as a parent. It contains clinical trial data, dosing and preparation instructions for providers, legally required reporting of any post-vaccine event, even if rare, unproven, or unrelated. In my 10 years, I've seen 3 side effects, and it was a febrile seizure after vaccines, and the children had no long-term impactment. At the end of the day, it's not designed to weigh risks versus benefits for an individual child. That's what your pediatrician and the vaccine information statement sheet are for. Next is indications and usage. This section says who the vaccine is for and what it protects against: measles, mumps, and rubella. It's a helpful reference, but if your child is following the routine immunization schedule, you don't really need to dig into this. Your pediatrician already uses this section to guide recommendations based on CDC guidelines as well. Next is dosage and administration. This tells healthcare professionals how the vaccine should be given, how much, where, and how to store it. Contraindications, warning, and precautions. These sections outline who shouldn't get the vaccine and special considerations like immunocompromised patients or pregnancy in this case. This is why continuity of care matters. Your provider keeps track of your child's medical history and uses that to make safe, personalized recommendations. You don't have to memorize this document. We're trained to know if this vaccine is for your child. And next, adverse reactions. This is the most commonly misused section online by anti-vax organizations, so let's dig in. Section 6.1, clinical trial data. This lists side effects observed during clinical trials like fever, rash, joint pain. These are expected, usually short-term, and part of the immune system learning to respond to the vaccine. Next, we have post-marketing experiences. This is where things get twisted out of context. This section includes any reported event that occurred after someone got the vaccine, even if there's no evidence it was caused by it. It even says, the following adverse reactions include those identified during clinical trials or reported during post-approval use of MMR vaccine or its individual components. Yes, it lists things like seizures, encephalitis, Guillain-Barré syndrome, thrombocytopenia, which is low platelets. That means that these were reported. If any reaction is reported to systems like VIS, even just once, it legally has to be included, even if it happened weeks later, even if it had nothing to do with the vaccine. This is over-inclusion, not deception, because this is a legal document, not a confirmed list of side effects. Now let's zoom in on one of the most frequently cited fears, encephalitis or brain inflammation caused by the vaccine. And yes, it's listed here. You might think, wait, isn't the vaccine supposed to prevent that? Vaccines work by training your immune system. They give your body a controlled preview of a virus or bacteria, just enough to build protection without causing full-blown illness. But sometimes, in very rare cases, the immune system can overreact, causing inflammation or other symptoms similar to what the infection itself would cause. But this is rare. And this isn't just a vaccine thing. This happens with medications and treatments, and that is why we always look at benefit versus risk. Even antibiotics used to treat infections can very rarely cause severe allergic reactions or gut problems. That doesn't mean they're unsafe. It just means we weigh the risk of the treatment against the risk of the illness. And let's get back to the numbers. Measles infection causes encephalitis in about 1 in 1,000 cases. The MMR vaccine, it's been reported in about 1 in 1 million doses. That's 1,000 times lower risk with the vaccine. So yes, a vaccine might carry a tiny risk of triggering a complication it's meant to prevent because it's working with your immune system. But that risk is far lower than the risk of the disease itself. And that's exactly why we use vaccines, to prevent more than they could ever cause. Before we compare to VIS sheets, just wanted to insert, pun intended, a reminder to support this channel by hitting subscribe, and you won't miss future videos. Now that you've seen what the insert includes, let's talk about what you should actually read as a parent, the VIS sheet. The Vaccine Information Sheet, or VIS, is created by the CDC and given to parents by law. You might get this before the vaccine or after. Unlike the insert, the VIS is written in clear, everyday language based on confirmed, evidence-backed data, focused on what you actually need to know. It explains what the vaccine prevents, what common side effects to expect, what signs are rare but important to look out for, when to call your doctor, the risks of the disease itself, and not just the vaccine. Can you read the insert too? Absolutely. But here's the difference. The insert is a legal record of every single event ever reported, whether it was caused by the vaccine or not. The VIS puts that information into context, so you know what's actually relevant for your child. Let's take a closer look at the risks of a vaccine reaction section of the MMR VIS. Common side effects: sore arm, redness, fever, or a mild rash. These are signs your immune system is learning. Swollen glands or joint pain, most often in teen or adult women, may also happen, and these go away on their own. Rare but more serious side effects: seizures, often tied to fever, happen in about 1 in 3,000 to 4,000 doses. These are usually brief and have no long-term effects. Temporary low platelet counts, thrombocytopenia, occurs in 1 to 30,000 doses and can cause bruising or bleeding. Again, temporary, and usually resolves without issue. Severe allergic reactions are extremely rare as well, about 1 in a million doses. In people with serious immune system problems, the vaccine could theoretically cause an infection. That's why this vaccine is not recommended for them. And yes, some people faint after vaccines, just like with other medical procedures. That's not about the vaccine. It's about the moment. As with any medicine, there's a very remote chance of a severe reaction, serious injury, or death, but this is extremely rare and monitored closely through national safety systems like VIS and VSD. So let's zoom out. The insert gives you the everything ever reported list with no explanation. The VIS gives you the what's actually known list with some context and clarity. You can read the MMR VIS sheets online here or at immunize.org, and we have all of this information below in our caption. And I also have a free vaccine handout linked in my caption that breaks this all down in real parent-friendly language. This is the handout designed for you, not for regulators, not for lawyers. It's how we help families make truly informed choices by balancing evidence, risk, benefit, and the context that matters most, your child. So next time someone says, "Read the insert. Did you read the insert?" you can say, "I did," or "I don't need to. I also talked to my pediatrician, watched this video, read the VIS, and actually understand what I'm looking at." And send this video to them. Because reading without context isn't power or knowledge, it's just fear with the highlighter. And informed consent, that comes from guidance, not a forwarded video on social media, unless it's this video. Now that I've broken this down, I want to hear from you. Have you ever been shown a vaccine insert online or in real life? What questions did it bring up? Drop a comment below. Myself and my team are medical professionals, and we're here to answer, educate, and support. And if you found this video helpful, please give it a thumbs up sign, share it with a fellow parent, and hit that subscribe button for more content that helps you feel confident about your child's health, development, and safety. And if you want more videos that go through each vaccine, looking at the VIS sheet as well as the vaccine insert and the benefit and risk of each vaccine, please comment below so I know that you want this series to continue. As always, stay informed, stay empowered, and I'll see you all next time. Stay well.